This is what a typical dental treatment room looks like. What we have here, basically, this is the patient chair. This is where the patient sits. Dentist typically sits kind of right around here and then works on the patient, usually around this angle. Basically, a dentist is a type of health professional that deals with the mouth. More specifically, they look at the teeth and the gums and any of the supporting structures that hold the teeth, for example, the bone. Simple things such as doing fillings, removing cavities, taking out teeth that cannot be fixed, or trying to restore an infected tooth. Those are typical responsibilities that we see of a dentist. Oftentimes, we have to be put in a position where we have to evaluate whether or not a tooth can be fixed or not, and if so, how you can go about having it fixed. That's kind of where it kind of dwells into different subcategories of dentistry. General dentist is basically kind of a jack of all trades when talking about evaluating, diagnosing, and treating conditions that are in the mouth. As far as my job responsibilities, obviously we would do a comprehensive exam when every patient that comes in gets a comprehensive exam. So we're basically counting the teeth. We're evaluating the condition of the teeth, checking for cavities, checking for existing fillings, checking the integrity of everything that's in the mouth. Not only is it checking the teeth, but we're also checking the gums because we're trying to rule out, if a patient has gum disease. So it's an evaluation of basically, the teeth and the gums and making a diagnosis of, again, as if something is fixable or not and how you go about fixing it. When you get farther into it, we have a lot of different responsibilities, such as we call it restorative meaning fillings. So we also deal with, fixing broken teeth or, taking cavities out of teeth, but, also diagnosing gum conditions. We also review x-rays. We take a lot of x-rays and we're reviewing for disease and pathology and stuff like that. And there's other things, too, that we deal with, that not just from a diagnostic standpoint or a restorative standpoint, but we also do replacement options. So if a patient comes in, they have missing teeth, one of our job responsibilities is trying to treatment plan different alternatives for that patient to be able to get replacements for those teeth. You can get more specialized, such as what's called a periodontist, which their specialty basically relies on looking and analyzing the gum and the bones of the mouth. Then you have something like an oral surgeon. They deal with more difficult extractions or removing teeth or weird pathologies and disease that we see on the jaw and the bone. An endodontist is basically a root canal specialist. They dealing with more difficult root canals that oftentimes a general dentist cannot manage. There's also what's called a pediatric dentist, and they basically manage children anywhere from the ages of 6 months all the way up to maybe 13, 14 years old. Then there's also what's called a prosthodontist. A prosthodontist deals with prosthesis, so anything that may involve something that's removable that goes in and out of your mouth, such as like a denture, or they can do something with what are called implants, which is like an artificial tooth replacement. They can also do other things with crowns and bridges, different versions of ways to basically fix your teeth. There's also what's called an oral pathologist, which is a specialty person that deals with disease of the skin or medical history abnormalities, or things just overall in the mouth that the general dentist can't basically diagnose and treat on their own.